Our treatments, therefore, are very simple at the outset in our clinic. Childishly simple to modern practitioners when we tell them what we are doing. But guess what? It works better. And why is that? Because it is so fundamental as a strategy of treatment that it is quoted in the Nei Jing. And we need to be clear. It is not effective because the Nei Jing said so. It's effective, and therefore the Nei Jing wrote it down. Hanja, Ruzhe, Ruzhe, Hanja, Shizhe, Xieje, Xuzhe, Buzhe. That's it. Should there be cold? Heat it. Should there be heat? Cold it. Should there be excess? Drain it. Should there be deficiency? Tonify it. Voila. That's it. Right? There's a few more characters after that, but like 8, right? Everyone at this point said to themselves, yeah, of course, Andrew. But here's where I need your help. If we think back on the patients we treated last week, in the last month, honestly, did we really start there and do nothing more than try to shift yin and yang at its most fundamental separation of if it's cold, heat it, if it's heat, cold it, if it's too much, drain it, if it's too deficient, build it? It's an honest question, because what I can tell you is if we have the discipline to not be distracted, but to start here in our treatments of complicated conditions, if we stop chasing the wagging, wiggling tail of reported symptoms and medical tests and things we read online and research that's happened, and instead start with this fundamental strategy without distraction, miracles stop happening, because good results happen too frequently to be considered miracles. If we simply look at the fundamentals of yin and yang in the clinic to see where the loss of harmony is and nudge that back into yin ping yang mi, close yin, calm yang. Literally, the term in Chinese is zhili, to govern, to bring back into harmony. Many of the complicated or mutually antagonizing symptoms go away. Just as many of the markers on our patients' medical tests change without us doing more than, if it's cold, heat it, if it's hot, cool it, if it's excessive, drain it, if it's deficient, strengthen it. And then, after doing this first, we can then really see what symptoms, what issues are left, and treat that instead of chasing the tail, which honestly is so tantalizing, waving in front of us when our patient starts giving us all of these things and what they did and this worked, and they bring in this patent and said, I felt better on this, but I didn't do this. And you're just like, oh, yeah, okay, don't do that. Do not be distracted by the bright, shiny object of our patients and their words and their medical tests and what worked in the past. In terms of raising clinical efficacy, that's where to start. Don't chase the tail, but look at the source or head, yin and yang. We perform a Copernican inversion on how we see and diagnose the condition. Start by rebalancing the fundamental yin and yang without being distracted by all that's going on, and then watch how many things resolve without needing to be directly treated until we see what must be directly treated. Our next slide